one of the most important things for managing trauma exposure in roads policing and in all areas of policing for staff and officers is knowing what we can do about it. The uncomfortable truth is that trauma exposure is part and parcel of contemporary policing, and possibly always has been. We know that in roads policing, that road traffic accidents and fatalities, particularly those including children, are scoring highest on people's reported worst incidents ever in their policing careers. So we know that trauma exposure to a certain extent is inevitable, but its impact on us, its negative impact on us, its long-term negative impact on us is not a given. There are things that we can do about it. And what we really need to do is not only accept the fact that we are going to experience trauma exposure, but accept the fact that we have a responsibility to manage how that feels, and how we can support each other in that experience. One of the predictors of PTSD that we found in the Job for Life survey in 2018 was around notions of shame and humiliation. And what's really worrying is, I think, that if people feel that they might have symptoms of PTSD, that there is that instant stigmatization that we often do to ourselves, coming from the culture or from our team or from society, but it might be so embedded in us that we might have a personal relationship with not wanting to talk, not wanting to express our emotions, not wanting to acknowledge how we feel, that we've been affected by life. So it really is important that in policing and in all roles that we learn to see shame and embarrassment for what it is and keep it in its place. And despite that initial hesitation that we might have to reach out to people, that we just do it anyway. And we need to start those conversations, and we need to try and develop a common language around the fact that, yes, trauma exposure happens on the job. It's going to affect me. This is what it feels like when it does, and this is what it feels like when it feels better. This is what it feels like to reach out to colleagues. This is what it feels like to get help. This is what it feels like to move on, and to actually have learned from that experience and build resilience from it.